This is the Soul-Filled Sisterhood podcast, and I'm your host, Nicole Burgess, licensed marriage and family therapist and an empowerment mentor for women. The information shared in this podcast is not a substitute, nor is it to convey professional, psychological, financial, or medical advice. If you could use such services, please seek them out from someone you trust. Now here is today's episode. Episode 61. Well, welcome. If you are not on my email list, I'm going to encourage you to go out to NicoleBurgessCoaching.com/mindfulness, and you can get some free meditations for you to download and help keep you up to date regarding my self-care summit that is going to be in October. It's actually called Self-Care Summit, Improve Your Bottom Line and Your Personal Life. It's really geared towards those of you who are entrepreneurs. So again, go out to NicoleBurgessCoaching.com/mindfulness, and that will get you the meditations, but also get you signed up on my email list. Now, here is today's episode. Well, welcome, sisters. I am so excited about my next guest. I have Dr. Katayun Kayene, and she is a PsyD, a PMHC, which means she's a psychologist certified in perinatal mental health, and she's also the creator and host of the Mom and Mind podcast. She was drawn to this specialty after going through her own postpartum depression, postpartum anxiety, and postpartum OCD with her first child. Dr. Kat supports mothers and families in her private practice in Southern California. She is a trainer and board member for Postpartum Support International. Dr. Kat offers training and education and advocacy in perinatal mental health to her local community and worldwide. So, Kat, I am so excited about having you on today. I know you and I have had other conversations before regarding your work, but I've not had you on this podcast yet, and I'm so excited about having you here today.
Thanks. I'm really excited to be here too. I love what you're doing, and I'm happy to contribute in whatever way I can.
Beautiful. Well, before we kind of dive into some specific questions about postpartum, would you share a little bit more about really like what got you into this work? Like what really drove you to specialize in this area?
Yeah, I've always known that I wanted to be a psychologist since I was 12. And so I did that. And then I kind of got the degree and was doing the work and still kind of felt like, okay, what am I going to do though? And then I got pregnant and had a baby and had a horrible mental health experience afterwards. And when I was kind of coming out of it and recovering a little, and looked into what I was actually dealing with, I just realized it was one of those things where I'm like, oh, I have to do this work to help other moms. Mm-hmm. Because number one, I didn't know what I was going through for a year. It took me a year to figure it out after my daughter was born. And I'm like, I'm a psychologist. I'm supposed to be able to know, like I'm supposed to know that this happens, but I didn't. Mm-hmm. And a lot of people don't. And I realized at that point that, geez, how are other people getting through this? And if I don't have the training and education and I'm a therapist, then how are other people who are not therapists figuring this out? And so that felt like a fire was lit under me, and I was propelled into learning more and healing for sure, mm-hmm. But also learning more about how to help other moms. And then, once I got into it, I realized it's not just moms that this affects. And it's so complex and complicated, but there's so little just information out there. So yeah, that was what lit the fire under me, kind of realizing that so many more people needed help. And it felt like a place where, although I had gone through it myself, I mean, I've been through other things and wasn't compelled to specifically, help those people who had similar issues. This felt just really viscerally like something I had to do.
Got a soul calling, huh?
Oh, yeah. Well, that's actually one of the ways that I look back on that time is it's almost as if, like something about my soul was coming through for healing. And that feeling was not necessarily ever in my kind of repertoire of looking at the world. But there was something so profound about it. It's almost, I'm going to do some woo-woo stuff here, but it was almost like a portal opened up, and I'll like in space and time or something. And all of these things that needed healing came through.
Beautiful.
In multiple ways with both of my kids. That happened in different ways, but it was, there was just no way to explain really the kind of spiritual soul journey that it all took me on. And I hadn't yet experienced anything that jolting.
And the beautiful part is that you listened to that. You didn't let that like go, oh my gosh, I don't know what happened. Let me hurry up and close that and pivot into a different way. You followed it.
Yeah.
What you talk about, and we're going to get into that in just a second, just kind of explaining what postpartum is and things to expect and all that. But you have opened this up for moms to know, and grad school, right? For the therapy world, right? Psychologists, MFTs, whatever. It's not a program that we're going to be talking about. At least I wasn't trained in it.
No.
And so when I first met you a few years back, I mean, you were the one that really started to open up like, oh my gosh. And I think so often, at least some of the clients that I work with, I'm like, hey, I'm not trained in this. This is not what I specialize in. But they don't even know what to ask. So they can't even go back and tell their doctors really what's going on because they think there must be something so wrong with them.
Yeah.
And it's not.
Right.
It's like, these things symptoms that they're going through. So would you mind sharing just a little bit more like what is postpartum? And I know you blew my mind when I first chatted with you a couple years ago about like how long it can actually last.
I don't mean to laugh, but it's not funny and it really sucks.
That was me, my mind blowing. Yeah.
So there's quite a range and spectrum of what can happen during the perinatal period, both postpartum and pregnancy. I'll give you like the overview. So the things that people mostly hear about are the baby blues or postpartum depression or postpartum psychosis. I think those are the like three things that are most kind of heard about but not totally known about. It's just this thing that happens. But there's a range in spectrum. So baby blues is about the first 2 weeks after birth. It's a really very common experience. About 80% of women are experiencing, a change in their mood and crying and tearful and, just kind of adjusting, but they're still able to maintain kind of their basic like happiness. You just might feel like a bad PMS or something, but they're still connected to, their themselves in a way where they still feel like themselves. When we get into perinatal mood and anxiety disorders, like postpartum depression, postpartum anxiety, postpartum OCD, postpartum bipolar onset, bipolar disorder, and postpartum psychosis, though that is the broad range of things, clinical diagnoses that can happen in the postpartum period. And those things can also happen in pregnancy. Depression and anxiety are pretty common in pregnancy. And certainly if those symptoms are being experienced in pregnancy, the likelihood of it worsening in the postpartum is much higher. So it's really important to catch symptoms early on. But because it's, it's like, oh yeah, you're pregnant. Of course you're moody, or you're all of those things that people say and dismiss people's feelings about. Like, yeah, you're a new mom. Of course you're tired. Well, for some people, that's true that they're moody or hormonal, as I hear a lot, and that might be the case, but it's transient. It's like they'll feel it here and there, or with the lack of sleep, they're not feeling all that great, but they're still feeling like themselves. So when we get into the more complex, more intense range of symptoms is when people are not quite feeling like themselves. Their symptoms are lasting for 2 weeks or more, or they're so intense that it's impacting their ability to function. So what I hear a lot is, I see women who are all across the range and spectrum of these conditions, some mild, some moderate, some severe, but it doesn't look one certain way. So a mom who's experiencing this could have her makeup and hair done and be dressed and, her kids well kept and, all of those things. Her house is clean, but that's not a sign of that she's fine.
Mhm.
And that's what gets confusing for a lot of people. Well, she can still do all this stuff. And even to the point where I hear people, they go into doctor's offices and they'll tell their doctor, I'm not feeling well. I don't feel like myself. And the doctor will say things like, well, you look fine. So you must be fine. And so this is one of those sets of conditions that it's not based on what you look like. Like,
Correct.
if you're not doing well, you're not doing well. It doesn't mean your outside appearance, you should be like disheveled and you can't lift a spoon. Some people are very high functioning, but suffering greatly.
Yes. And I want to pause you there because in my work with those who are clinically depressed, right, I still do that somewhat. That's often the case. We call it the mask.
Yeah.
Mask of everything. I've got my makeup on, my clothes are looking good, and I look good on the outside, but on the inside, I'm feeling awful, feeling miserable.
Yeah.
So there is that dismissing, like you're saying, and saying, nope, I may look good out here, but the inside, I know this isn't okay.
Mm-hmm.
Yeah.
Yeah. That happens very often.
Mm-hmm.
Especially because all of this prevailing myths about what motherhood is supposed to look like and feel like. You're supposed to be happy and joyous and grateful and, love being a mom and all that, which is not true all the time. Oh, and also you're supposed to bounce back, whatever that means. Like, and your body is supposed to bounce back. This is all part of the myth and misnomers, I guess, the misconceptualizations of motherhood. That's not how it goes.
Mm-hmm.
That's not how it goes at all.
Right. We're going to take those myths and like throw those out the window. Go, here's what it really looks like, lady.
Yes, it's hard.
Yes,
it's hard. Even if you're don't have a clinical diagnosis, this is hard. And I just think we do such a disservice to women and families and babies by putting this pressure on women to look and be a certain way. When, the denial of their reality is part of what causes them to feel depressed and anxious.
Yeah.
I'm supposed to feel good and I don't. I'm supposed to, I feel terrible. This makes me a bad mom because I can't live up to these expectations, or I don't feel like I can, or whatever the internal narrative is. This is literally contributing to people's depression and anxiety as these myths. So let's bust those wide open.
Well, and the other thing too is if the doctor that, these women have talked to and they're like, no, you're good. And they're not, it's like, continue to advocate for yourself, or you may actually need to find a different doctor.
Yeah. Yeah. Right.
Because I'm like, you are your only advocate. I mean, you are the best advocate, which is you. Mm-hmm. So yeah, if they're not listening, it's like, okay. And I know you've talked before on your show with others and all of that there's also training to go through. And so if doctors or the healthcare provider that you are working with does not have any idea what you're even talking about,
right?
It really is trying to find somebody, or not trying, but it is to look. And I'll put the website and stuff in the show notes too about where they could do some searches for that along with yours. But it's like, just you've got to find the support that you need during this time because it's critical.
It is. And it's, to your point, like it's the way our kind of systems are set up, not specifically healthcare, but sure, healthcare. But our kind of cultural systems are set up around motherhood is that the onus is on the mom to also find the ways to heal herself.
Yeah.
We don't have the community set up that comes in and takes care of her in the way that she needs. Mm-hmm.
Yes.
Right. So like the self-advocacy is a major part of healing in this culture, in our broader culture. But it's so hard to figure out how to take care of yourself when you feel horrible, when your brain isn't kind of, working the way you're used to it working, where you can't remember stuff and you have a hard time tracking things, or, there's just so much going on during the day that you forget. it's really, I don't know, it's kind of a catch-22 for new moms.
It is, and that's a wonderful point to make. And I think so much of this is, as you and I have talked before, it's like, there's so much messiness in all of this, and giving yourself permission to, it's like, here's where I am, and I'm going to take this next step. And it's not like you're going to, everything's going to happen overnight, and it's not expected to happen overnight. But if you're struggling with any of these symptoms, it's like the advocating, it's like, oh, I may not find that doctor tomorrow, but I'm going to continue to search.
Yeah.
That is it. The majority of our culture is not set up to come in and like, what do you need? We've got this to help you. And I'm, doing hand gestures that nobody can see, but it's like wrapping around.
Yeah.
We're here to really support you. And that's, the old saying, it takes a village to raise a child. It's so true.
Absolutely. Yeah. There's a lot of things that could change that would help. But here we are.
Yes. And I think, again, part of the work that you're doing, though, is really helping make those shifts because you're putting it so much out into the world of raising the awareness, raising the vibration, and saying, well, ladies, you're not alone in this.
Yeah.
I think that's a huge piece.
Yep.
So that they know they're not the only ones who are going through something like this, and that there is really, truly support. And I want to pivot one more time. I know you and I were talking before I hit record. You're a highly sensitive person. And so we were talking more about this too, that the needs of an HSP, they are different than non-HSPs. It's not like we're better than, it's just truly different needs. And so a mom who is an HSP and going through this, what are some of the things that you found really helped you once you kind of figured out what was going on? What are some of the things that you did that supported you? And now you're like, you again, kind of share this with some of your clients.
Yeah. So my journey to fully understanding my HSP, the factors for me personally came after I figured out. I mean, well, let me correct that. I knew I was an HSP, but I didn't, from like age of 19, I think I read Elaine Aron's book. And I was like, checklist. Yep. But I didn't read the whole book. So as is still true for me. It's hard to get through a full book. I'm like, I just need the information I need, and then I'll put this down. But anyhow, I digress. So I knew I was a sensitive person, but I didn't understand the full context and complexity of it until more recently, like a couple of years ago. So looking back on my experience, there were so many things I would have changed. But now I really incorporate a screening for HSP traits when I'm meeting with new moms, especially when I hear that they're having anxiety, but they can't quite figure out why, or, I mean, I can point to some reasons why they might that are, logistically make sense. Like you have a new kid. Hey, that's going to bring in some anxiety. But there's this other level that HSP moms experience the world in. And, there's different layers of overwhelm with having a new baby. So I incorporated a lot now in my work and assessment with moms. But for me personally, there are things that I've changed in my own life now too, to really like, okay, yeah, I knew I was sensitive, but that also means that I have to be super protective of my sleep. So yeah, and the moms in the perinatal period are already struggling with sleep often. It's rare that I hear that sleep is going fine the whole time throughout pregnancy and postpartum, because usually there's either nursing or bottle feeding, or there's a baby who's waking up every 2 hours. So of course sleep will be disturbed. So some of the things that I mean, I just feel like information is so powerful, and giving and doing an assessment to see if they kind of meet the cutoff or whatever for HSP traits for the sensitivity, kind of early on in my assessment with them, so that I can help them understand why things feel so overwhelming, and why the cry of their baby is so upsetting to them. Not that it wouldn't be for other moms who are not HSP, but I sort of explain it to them like the world is kind of operating at a volume level of maybe like 7, and you hear everything at about 11.
Yeah.
To kind of give them a sense of like, yes, it's overwhelming for other people too, but for you, it kind of takes over your system. And I think really kind of helping them understand some of the brain-based ways in which they're perceiving things, and in a non-personal way. Like this is part of just how your brain might be functioning.
Yes.
And so to take care of your brain and your system, you're going to need a little bit more downtime, or you might need a bedtime routine yourself. So yeah, sleep for me, any perinatal mom is at my number one priority. But with HSP moms, I have to take a deeper dive to talk about why for them it's so much more important. So yeah, sleep, and then taking time, finding time, asking for time, negotiating time away.
Yep. Even 15, 20 minutes, right?
Oh
it's
gosh,
like that can make a huge difference. And I know for some women, they think, well, I have to do hours. It's like, no, you don't, sweetie. It's like some of it's just smaller chunks. If that is all that's truly available,
right?
Step out of that and not just check in, social media. It's like, because it's still stimulating your brain.
Yeah. Right. Yeah, absolutely. That's so true. Get it in where you can fit it in. It's like any little chunks of time are helpful. But, if you can negotiate with a family member or your partner, whoever, where you get 2-3 hours, every Saturday.
Yes.
That it's just yours, or you can count on it. You can look forward to it and do what you need to do to take care of yourself. 2 to 3 hours out of, however many hours there are during the week is not a lot in the scheme of things, but it's absolutely critical for you to have downtime and alone time.
Yes, absolutely.
Yeah, that time alone, sleep and time alone are the two bigger ones. But in the day-to-day, we kind of talk about overstimulation quite a bit because it can happen so easily.
Yeah.
Yeah. I don't know anything about that though.
Yeah.
Yeah. The stimulation, in those moments, especially with babies cry. And for some people that the pitch and the tone is especially overstimulating. So I try and put that in context. Like, this is why this might feel so overwhelming. And sometimes just having that to hold on to, like, oh, okay, this is part of what's happening, is enough. And then other times finding really more cognitive based ways to manage, their own response to it. Like, what's wrong with me that I can't deal with my baby's cry? We can change that internal dialogue to something else. So it gets to the practical level there too. But yeah, dealing with the overstimulation and putting it in context is a big one.
Well, and I think what you're talking about too, from the postpartum to being an HSP, it's like all of this, it's like, if you don't really know who you are, having this, the assessment of like, oh, am I an HSP? And oh, are these the symptoms of postpartum? And all of a sudden it's like, oh, with that information, there's power in that.
Oh, yeah.
Like you said, because now it's like, oh, I have a better understanding versus that self-criticism, the inner critic that loves to pop up, which is all ego crap, right? Just wants to take over and say, somehow you're not enough. And it's like, it's not true. But you're beginning to pivot that. It's like, I'm just having a harder time because I am sleep deprived right now in this moment. And it is a moment in time. It's not a forever.
Yeah. Right.
Yeah.
Right. And it can feel like a forever because it's like, well, this means I'm a bad mom. It gets into this really deep level of stuff. I hear it all the time.
Yeah.
Like, it doesn't have any bearing on who you are.
Correct.
It just has a lot of bearing on what you're going through.
Yes.
And to your point, it's temporary. But when you're in it, it feels like not temporary. It feels like you're going to feel like this forever. For a lot of people anyways.
And the other aspect we were talking about too before I hit record is sometimes just stepping out in nature. And that really does a lot for HSPs.
Yeah.
And it can for people in general. I mean, there's so many studies out there how nature can soothe people and calm the anxiety down. And so if you have the ability to just step outside, whether, just feel the breeze, feel the sunlight, whatever, listen to the sounds, that can help calm the nervous system down. Bring you back into the moment.
Yeah, absolutely. Yeah, even if it is just, if all you have is a patio or a balcony or, something that you can step outside while your child is sleeping to feel the sun on your face.
Yep.
Or get some fresh air. That's all part of healing.
Yeah.
or respite for a moment at least.
Exactly. And I also like how you were talking earlier about, negotiating or asking for really what you need. That it's like, I need this Saturday or these Saturdays for a couple hours at a time, that, putting that into the calendar or letting family members know, or spouses, like, I need this support so that I can, continue to be the best mom I can be, and also spouse, family member, whatever, all those roles that we play.
Yeah. Right. Yeah.
But it's just like, for the core of me to really thrive, I just need this. And it doesn't make you selfish. It doesn't make you greedy. There's nothing wrong with you for asking that.
Yeah. No, it's surprising how hard it is to ask for it.
Yeah. Well, I still think, I know I've talked on previous podcasts, I can get on my own little soapbox here, but there's still so many messages out just for women in general that it's selfish to ask for that downtime or take time away. And then it's like doubled, it seems like, for moms.
Oh, yeah.
Wait a minute. No way, man. You got to do this. It's like, that's a piece of you. That's not all of you.
Yeah. Right. Yes. So, yeah. Right. To that point, I like motherhood, and new motherhood in particular can be overwhelming and all consuming, because there's also this other, I don't know if you want to call it a myth, but like the self-sacrificing mother, the person who just does everything for their child all the time, no matter what. And there is a value put on, in some sense, women who do that, who set aside themselves in order for their child. And it's almost like, held up as like,
I was going to say, it's revered. Yes.
Oh yeah. Yeah. And that might have worked back in a time where women weren't also working, when family was just around and it was, everybody lived on the same block or whatever, families were just closer because it was also within the fabric to be able to have more help in those ways. Not for everybody, but but now with like families living farther apart and people not necessarily having the help around, a lot of people feel like they do have to do everything. And certainly for single moms, they do have to do everything unless there's support around. It's really complicated, but the myth prevails in all of the situations. Even for people who have a lot of help, I still hear it. I'm supposed to be the one who feeds him. Yeah, this is what my body is for. That sort of stuff. It's a really fascinating dynamic.
And I'm laughing not because that it's true, but it's just like, wow. It's like, and there's more than one way to do this.
Oh yeah.
And I think that, it's like the revered piece of, being really kind of the martyr of it. It's like, it's detrimental, not only to the woman, but also to the child, to the family, because it goes on from generation to generation then.
Yeah.
No.
Right. And then like moms all over the place are burnt out and frustrated and tired. And, when you're like that, it's much harder to mother.
Correct. Yeah. And then that just keeps the negative self-talk going. It's like, well, I just yelled at my kid again and that didn't go well. And now I've made my partner mad because I've also said this, and this to them. And it's like, it perpetuates it versus, whoa, what am I telling myself? It's like, give myself permission that, yep, this didn't go so well, and that's okay. That I can, do this differently, or I can ask for this help, or just take a moment. Like if it's not done perfectly, which nothing ever is, and nor can it be, it's okay.
Yeah. I wish that was the prevailing message.
Yeah. Well,
that would help a lot of people.
Again, I think this is so much of what part of the work that you're doing is really helping break through these myths and changing that inner dialogue and changing the stories, right? We get wrapped up in our stories that we've learned and that we're unlearning and saying there's a new way of doing this.
Totally. Yeah.
So, and I think part of what, you're talking about and what we were sharing here a little bit about the self-care and advocating for self and taking that time away, it's not losing that connection to who you truly are. And helping the women that are out there. It's like, whether you've gone through postpartum, you're going through postpartum, it's like, keep speaking your truth.
Yeah. That's important.
Yeah.
That is super important. But finding someone who will listen. If, like you were mentioning before, even if you're trying to talk to your spouse or your friend and those people aren't listening, so find somebody who will listen to you and understand you, take you seriously.
Yeah.
For some people that means going to therapy. For some people it doesn't. But that is so important to feel like you have a safe and soft place to land in the world.
Yeah.
With this stuff is key.
Very much so. Well, I'm curious, Kat, would you be open to talking about kind of like how you are managing all this now? Because you've got a few kiddos and you run a business and you do this podcast and you're an HSP.
Yeah.
What are some of your practices that you use now to help you support you while doing all of these other roles that you have or do or choose?
Yeah. Sometimes I do it well and sometimes I don't. Still get overwhelmed and burnt out when I'm not paying close attention. But that's part of it, is paying close attention.
Right.
And trying to manage and regulate how much I'm doing. Over the past couple of years, saying no has become a strength.
There's power in those two letters.
There are, yeah. And even to the point where I've had to kind of go back to people that I said yes to and say, actually, I can't. And that's felt really, really good. So I'm setting boundaries around stuff that every time I think, oh yeah, I can totally fit that into my schedule, I'm going to do that. And then at that, I would just do that over and over and over, and then have a full schedule of stuff that I couldn't actually do. So now, before I say yes to anything, I think it through. Sometimes I need to consult with a friend, friends who have agreed to put me in check on decisions that I make. Like, Kat, I don't know if that is that really the best thing for your energy? And that I give myself time to make decisions. As before, I used to want to, help and please and all these other things. So saying no, and having those boundaries and being really realistic with myself around what a particular event or time commitment is going to do to me. Not just like, oh, that would be so great to do, I want to do that. But I have to really think through what are the consequences of doing it for me energetically. Like, how long is it going to take for me to recover?
Yep. And again, I'm smiling as you're saying this because I have this topic or this conversation with so many women that I work with and myself included. I'm like, just underestimate how long that would be. Oh, I did. Poop.
Yeah, right? Shoot, I did it again. Yep. Right. So I'm managing kind of those potential outcomes and making a decision based on what's sustainable, if that makes sense. And I don't always do a good job of that.
Right. Again, we're not talking perfection here. Is sometimes we literally learn through the experience.
Oh yeah. Yeah.
And so it sounds like what I'm hearing is there's this constant giving yourself permission to really modify. Like, hey, this is really working. Nope, I'm going to check in with the friend because I think I've got this. And then when I hear that reflected back to me, I'm like, oh gosh, no, because I dropped it to my body versus in my head.
Oh yeah. Yeah. That for me is really helpful because I have some therapist friends who are keen on that kind of thing. So they'll help me out there, but also my non-therapist friends will do the same. I go to therapy too. So I have my own therapist, and for me, because I am a depth processor, I need to get into the nitty gritty of details that may seem like overblown or too deep for other people. I have to. It is important for me in my processing. So, there are things that I can talk with my therapist about that I wouldn't necessarily, in the depth that I would necessarily talk to friends about. So that's one way in which therapy is really helpful. Because I'm deep in my thinking.
Yeah. Which again, I love you embrace that part of yourself.
Yeah. Well, it's kind of not going away. So
exactly. But that's just it. It's like, this is part of who I am. And
it is.
It is going to cause more suffering.
Oh, totally.
Embracing it.
Yeah. I can't shut myself up. in my own head. I really do need that depth of processing to do it with someone. There's sometimes I got to cut myself off in my own head too. And that's part of kind of managing it. But for the most part, I don't want to stew and stay in a place where I feel stuck. So if I'm feeling that way, I'll reach out. But yeah, that's one of the ways I manage it. I do need time alone, probably more than I think I do, or more than I schedule or allow for myself. But when that catches up to me, I will ask, sort of negotiate that with my husband, and or take it, if I'm in my office and I feel like, okay, I can't really think anymore. I will take some time to myself, lay on my couch, or that's why I have a couch in my office. It's really for me.
Yep.
Like nobody else lays down on this couch.
Right.
Yeah, just take a moment like that. I personally really need exercise, or my mood starts to tank. So whatever that is, sometimes just a walk. But lately I've been doing a lot of hikes, and that gets me into nature, which helps too.
It's a double win.
Yeah, it is a double win. I do like hiking for that reason. Some other things that I do are how I interact with my kids or with my husband is, if I'm overstimulated, I will tell them.
Yeah.
Because I think what I used to do is feel overstimulated and then like feel that I had to still do everything or still manage just the same as I had been before. But there will be instances where, like, the kids are loud, or the TV's on or something. There's a lot of noise, or there's a lot of change happening at once, and it gets me flustered.
Yeah.
If it's happening for too long. So now that I know about all of this, I can recognize, like, oh gosh, I'm overwhelmed right now. I'm overstimulated. I can't really give you a good answer to your question because I can't think. So especially around my period, frankly, I will tell my kiddos, like, oh, mommy's a little bit grumpy, and I'm going to do my best to manage it. But I also I'm feeling that right now. I just want you to know it's not you.
Well, I love the authenticity, and really it's not the old patterns for some folks, right? If we allow our fears to really run it, it's like, oh, I'm going to mind read, right? See what other people are thinking and how I'm behaving, and you're articulating, nope, this is where I am right now. It's not about you. This is what's going on. I'm going to need a little more time. Then there's no more guessing on either party.
Right.
Staying in your own lane, and you're role modeling that to your children, to your partner, so that they see it and they get it. And if they have a question, they can ask.
Yeah, I'm hopeful that yes, I agree. That's my hope, that being as clear about it as I can when I know what's happening.
Yes.
It helps, especially because my daughter is pretty clearly an HSP too. And we talk a lot about, I'm like, mommy's sensitive, and I think you're pretty sensitive too, and we'll figure this out together. And, just trying to, I didn't have language for this when I was little.
Right.
She's 9, and, she doesn't, she'll be able to say now that has this sensitivity, and she doesn't feel bad about it. It's just part of how her brain works.
Yep. Well, and I think, again, that's it, right? It's the information that you gained over the years, the training that you have. You're able then to not only help women, but you're helping your own family members in that sense, where it's embracing these strengths and not thinking that there's something wrong with you. And again, it's not letting fear talk really take over things, like, oh, I've got to people please everybody. It's like, no, that doesn't serve anybody either. And that just burns you out and exhausts you. Yeah. So setting those boundaries, like, here's where I'm at, and all of this noise around me is really overstimulating me, and I need to have some quiet in order to process it, and then I will get back to you. Yeah. And
it makes it so much easier. Once you know what's happening, you have the language for it changes everything. Because how I was managing, or how I was in the world before, is just feeling bad about it, feeling like, oh my God, there's something wrong with me, and I can't communicate what I need, and I can't think, and why can't I answer their question? And it's because my brain is processing everything all the time, and I can't do this right now.
And I think that's so common for so many HSPs, because it's still, even with Dr. Elaine Aaron's work, it's like people are still learning about it.
Yeah.
Right. And
Yeah.
so it's like, wait a minute, there's traits for this. What?
Right.
And when they go out and they take the quiz and they learn about it, it's like it impacts how you are an entrepreneur. It impacts how all these roles that you're in. And
Yeah.
it's like, again, really reconstructing these old perceptions about what you should or should not be or
Right.
do.
Right.
And it blows it out of the water. And then you start to manage like, wow, energetically, I'm all aligned. Oh yeah. And I'm aligned with my values. And oh wow, life is a lot easier now.
Right. Right.
Yeah.
Yeah. And wow, I like one for me in particular, I am part of my traits is true for a lot of HSPs is you walk into the room and you know who's having a hard time, who in the room is like, not having their best day. And before, because of my own history too, combined with everything, I would want to fix it for them and I would want to help them.
Yep.
And now I can be like, oh, wow, that sucks.
Yep.
And if it's like a friend or something, I will absolutely, or a family member, I might choose to check in with them, but now I don't feel compelled to have to fix it.
Correct.
I can notice it and not, and realize that my like spidey sense is picking something up, but that I'm not, that I don't have to make decisions based on that. Like I can make the decision that I need to for myself.
Yeah.
If that makes better sense.
Yeah. It's so true. So ladies, I'm sitting here thinking as I'm chatting here with Kat that in the show notes, I will have Dr. Aaron's quiz in there as well. If you've not listened to any previous podcasts, I believe this is episode 9, I was talking about the traits.
Oh yeah.
That you can go out and you can go, wait a minute, am I an HSP? Because what they're talking about sounds really familiar. I really am a deep processor. The lights kind of for me, lights are a big thing. Right. Sounds not as much, but I know like what you're talking about, there's too many sounds going on. It overstimulates your system. And so every HSP is also different because we're all different people and there's different degrees of that. It's acknowledging that. And if you are also, pregnant or just had a kiddo and you've got some other symptoms starting to show up, depression, anxiety, again, there's, it's the organization that has, it's Postpartum Support International, correct? That also has links out there. And I'll put the website out there on the show notes as well for women. But just, there's some great information that is out there. And again, information really is power. Yeah. And as you and I were talking about saying no, asking for support, having your downtime, whatever that may look like, sometimes even just truly closing your eyes for a few minutes really can help with the overstimulation.
Yeah.
Because your eyes aren't taking in all the stuff either.
Yeah, right. So true. So true. These little tricks are so valuable.
Yeah, they sound like they're nothing. And at the same time, it's like, nope, they can really make a big difference where you are in that moment.
Mm-hmm.
Yeah,
absolutely. That's so true.
Well, Kat, before I give the ladies who are listening your website and stuff, is there anything else that you wanted to share that I didn't cover? Anything else besides listen to your podcast for sure, Mom and Mind? You've got incredible guests on there and tons of great information and support for ladies who are going through postpartum, have gone through, or just want to know more about it. Tons of information out on your podcast. But anything else that you'd like to share that I didn't cover?
Yeah, I think it's really important to note that perinatal mood changes, perinatal mood disorders in particular, are some of the easiest to help people get through.
Beautiful.
There's so much hope here. It's not, I think postpartum depression comes with a lot of baggage in terms of how we think about it and what does it mean about somebody. But the reality is these are all very treatable conditions, and we know how to treat them. We know how to help moms get through it. We have answers for this, and so people who are experiencing any symptoms, you don't have to figure it out on yourself. You don't have to go through it alone. None of this is your fault. It's very unfortunately common. A lot of people experience these things, but nobody talks about it. Yep. So all of us are sitting in the caves of our home feeling terrible about ourselves, when the reality is that there are a lot of us waiting to help you, and we can help you, and we do. This is why I love working with this population, because once we make a couple of changes and do a little bit of work around what's going on, the improvement is relatively quick. It depends on the condition for sure.
Yeah.
And I'm certainly not guaranteeing any like time frame, but these are things that can be managed. You don't have to stay at home and suffer. It's just a matter of finding the right help.
Yes. And I think to go to that point where it's like sometimes the relief can be almost instant just when you know more about it, and to know that you're not having to do it by yourself. It's like, oh, and you've watched the shoulders drop.
Yeah.
And it's just like,
I love that.
Hey, there you go. We're on our process here. This is our journey for the moment.
Yeah.
Yeah. So ladies, Kat's website is truly called Mom and Mind. It's all spelled out. And you can find her on Facebook as well under Mom and Mind Podcast. And you can find her on Instagram under Mom and Mind. So, Kat, I just want to say thank you ever so much for coming on, sharing your own personal story and how you've learned more about yourself through the years. And now it's being able to, again, help the women that you work with, the families that you work with, and also your own kiddos, being able to have the language so that we can keep breaking these myths that are so unhelpful and keep us stuck in the brain. And then making more of these generational changes, saying, no, we don't need to keep living that way because it's no longer true. So thank you so much for being on.
Yeah, I'm thanks for having me. I'm glad to share this information. I'm such a loud sort of advocate for perinatal mental health issues. So I'm happy to talk about it wherever I can, in hopes really to reach that mom who doesn't know that she can feel better, and give her the hope that she can. Thanks for having me on.
Thank you for listening. And as I said earlier in the podcast, go out to NicoleBurgessCoaching.com/mindfulness and download your free meditations and get on my email list so you can stay up to date with all my latest offerings, podcasts, and other things that I do not talk about in the podcast. See you there.